They told you, with your personality, with your hair, with your hijab, with your skin color, with your preferences, with your gender. They told you, with their silence, with their words, with their resentment, with their absence. They told you, you don't belong. Yet, here you are.
Hello, my name is Omar Wolf. I am a third-year medical student from the University of Southampton, as well as the Skills Vice President of the Southampton University Surgical Society.
Hi, my name is Sayan Biswas. I'm a third-year medical student at the University of Manchester. I'm also the President of the University of Manchester Organ Donation and Transplant Surgery Society.
Hi, my name's Ellie Priestman. I'm a fourth-year medical student at Bristol University. I'm also the ACIT Equality and Diversity Ambassadors co-chair, as well as being the Vice President at the Bristol Women in Surgery Society.
Hi, I'm Michael Okocha. I'm a General Surgery Registrar in the South West, and I'm the Association of Surgeons in Training Equality and Diversity Officer. I really hope you enjoy this episode of 50 Faces of Surgery. I hope that it leaves you feeling valued, inspired, and most importantly, welcome. Here I am.
Graduating in 1986 from the Welsh National School of Medicine, now known as Cardiff University, Mr. Justin Morgan was appointed a Consultant General and Renal Transplant Surgeon at the Royal Devon and Exeter Hospital in 1996. He then moved on to Southmead in 1998, where he has been stationed ever since. His specialist interests include renal transplant, thyroid, and parathyroid surgery. Beyond his role as a Consultant General and Transplant Surgeon, he also works closely with Bristol Medical School as the appointed Dean for North Bristol Academy.
Hi, Mr. Morgan, pleasure to meet you. So my first question is, can you take us through your morning routine?
Well, I suppose it's different every day, and which is one of the things that's nice about medicine, of course, is there's never a routine. So it all depends if it's an operating day or not. So if I'm operating, then I usually get up about maybe 6:30. I'll be in hospital by about 7:30, seeing patients at 7:45, something like that, ready to start fairly promptly. If it's not an operating day or post-op day, maybe then maybe I'll get up slightly later. Although we do have a fairly new puppy, so actually getting up early has become a pretty routine these days.
Thank you. My second question is, where did you grow up?
So I was born in Yorkshire, in the north of England, but moved to near London when I was 3, and then to Somerset when I was 8. So we moved around quite a lot. But I grew up really in Somerset, near nearest little village called Evercreech, which is in the middle of nowhere, really. Although it's become very fashionable around there now. Bruton is where I went to school, and that's become really dead fashionable. But when I was at school there, it really wasn't. Yeah, I grew up there, and then went to Cardiff to medical school. Yeah.
Right. And what was life like growing up?
Yeah, so we very much lived in the country. I had 2 older sisters. One of my sisters was very keen on horses, so we had loads of pets, dogs, cats, chickens, all sorts of stuff, really. And my father had grown up on a farm, so he was quite good with animals. I think he should have been a vet, really. I think that's what he would have been good at. Yeah, we had all sorts of livestock, but I guess it was quite an isolated place to grow up. You could only see one other house from where we lived, so I guess I was quite self-sufficient. My two sisters are quite a lot older than me, so I sort of grew up, sort of by myself, really. But nevertheless, it was a really nice, a really nice place to grow up. I drove past it not long ago, and I thought, yeah, this is all right. I like this. It's a nice place. Yeah, Somerset's a nice county. So I went to school in Bruton in Somerset, and I got interested in going to being a doctor really very early in life. I don't know, and I can't really explain to you why that is. It sounds a bit lame, really, to say I don't know why I wanted to be a doctor, but I always wanted to be a doctor. I never wanted to be anything else. My father was a PhD, so he was Dr. Morgan, but he wasn't a medic. And I don't know whether that inspired me. One of my sisters is a doctor as well, but no one else in our family has ever done medicine. So yeah, it's an interesting. I don't know why it grabbed me, but it did, and it never stopped grabbing me.
I guess moving apart from applying for medicine, what was medical school like for you?
Oh, medical school was brilliant, really. I nearly went to St Andrews, and then the last minute I ended up in Cardiff. I was a very keen rugby player, and Cardiff was a great place to be a student. So I played in the rugby team. I was president of the Students' Union. I really enjoyed it in Cardiff. It was great. My only regret is I only did 5 years. I wish I'd done about 25 years. Being a student was absolutely brilliant. And so it's now part of Cardiff University, but it used to be the Welsh National School of Medicine, and it was quite small. We were at 150 per year, so by the end you pretty much knew everybody. It was a nice, very family feeling, and there was a lovely lady who used to run the sort of academic office, Mrs. Jones, who knew everybody's name, and if any problem you had, you just turned up and she'd sort you out. So it was a really lovely place to be a medical student, actually. Yeah, I really enjoyed it. And Cardiff's a super city to be a student. So had a great time at medical school. Probably had a bit too great a time, really. Probably could have worked a bit harder. But hey.
And moving forward away from medical school is very painful for me because I only have 1 year left myself. But where did you do your training?
So I started life being what used to be called a houseman, so foundation in Cardiff. I did, in those days, you did a 6-month house job. So I started off with 6 months as a surgical houseman in the Heath in Cardiff, doing vascular and general surgery. Yeah, that was an interesting time. Actually, I learned an awful. I knew I wanted to do. I thought I knew I wanted to do surgery, and that 6 months was excellent. I had two really brilliant registrar and SHO, who were the most focused people I'd ever met. I'd never met people who went to work every day and thought, right, what am I going to do today to further my career? What papers am I writing today? These two guys, one was a chap called Alan Bryan, who turned out to be a cardiothoracic surgeon in Bristol and has just retired. And the other was a guy called Harold Kynaston, who's professor of urology in Cardiff. And they were two very, very focused people who made me realize that if you're going to succeed, you really, really need to get your act in gear. Because I was probably just sort of drifting along, I went through medical school, passed exams mostly, it was all fine. But I wasn't really, I wasn't making as much effort as I could do. And when I saw these guys, I thought, wow, it's time to up your game. After I finished that, I went to Leicester and did an MD in transplantation immunology in Leicester. I actually went to do an MD in vascular surgery, and I got sold to the transplant unit by the Professor Bell, who needed somebody to run the transplant unit. And so I got transferred to the transplant unit and did a transplant MD instead. And these are the sorts of things that shape your career, guys, believe me. You think you've gone to do one thing and suddenly you're doing something completely different. But I found that transplant really suited me. I really enjoyed the transplant, I enjoyed the surgery, but I also enjoyed the medical part of it. So I did transplant for sort of 2 years during my MD, and then I stayed in Leicester and did what was then called senior registrar, so yeah, further training. I did more transplant, more general, and ended up as a sort of general and transplant surgeon. That's what it said on my first job description.
And what was your first week as a consultant like?
Well, so it was my first day as a consultant was an interesting one. I went to Exeter to be a consultant from Leicester. And the first day I got there, they said, "Oh, great." They said, "We've got a transplant today." Now, bearing in mind that Exeter was a tiny transplant unit, they probably did about 20 to 25 transplants a year, so really small. And so the fact that there was a transplant to do the first day I was there was quite a thing anyway. And it was a chap who'd been on the transplant list for 20 years without ever having a transplant. And he had an anal conduit, which was something that I'd not come across with transplant before. And I thought, here we go, sink or swim time. So we did the transplant at about 10 o'clock at night, as you know, it's when all transplants get done, of course. And it all went pretty well, actually, which was great. And when it didn't go so well was I walked out of theatre. And I guess my head was in a bit of a spin, really. You know, first day I'd started at 8 in the morning. Now it's about midnight. And I walked into the recovery room and didn't spot the wet floor sign on the bollard, slipped on the floor, smashed my head on the wall. And I was lying and literally seeing stars floating around my head. I thought, oh God, I've had one day of a consultant and I've killed myself. Fortunately, I managed to survive it and crack on.
And along your incredible career, what challenges have you faced?
So I think if I've been guilty of anything, it's been trying to do too much. So I guess the main challenge that I've had throughout my career is trying to keep too many balls in the air. So, I mean, there was a time some years back when I was doing a lot of general surgery, and we started the bariatric surgery program in Bristol, myself and another consultant, and I spent quite a lot of time doing quite a lot of laparoscopic bariatric surgery at the same time as everything else. You know, one of my other interests is medical education, as you know, Michael, and I'm the work with the University of Bristol, and that's, you know, it all adds up really. So I guess all of that provided a challenge of, you know, not enough hours in the day. Yeah. I guess something that I've understood and got better at as time's gone by is how to delegate. So allowing other people to make decisions, it's really important. You can't control everything all the time. If you try to keep too many balls in the air, you just end up dropping them. So it's better to give some of them to other people. This analogy is going way too far, but you know what I mean.
I get what you mean.
It's really important to trust other people and to allow other people to develop and allow other people to flourish, rather than trying to be in charge of everything yourself. So yeah, I think that's the challenge of trying to keep everything going. I mean, probably I'd have been better off dropping a few things a bit sooner, really. When I stopped doing bariatric surgery, it was quite a relief, really, because it was a huge workload and I wasn't really paying attention to other things that I wanted to do more, like endocrine. So yeah, understanding when you're becoming overcommitted and not saying yes to everything. I do tend to say yes to everything. But then I've always taken the view that, well, if you give it a go and you're no good at it, you can always say, well, I'm no good at this, and give it to someone else.
Do you have another moment in which you feel that you were challenged and you ended up changing trajectory?
Yeah, so I think there was a moment when I was a houseman. I worked in Cardiff Royal Infirmary, and it was a Saturday morning. I was on general take. It was pretty busy, and one of my friends was with one of the other housemen. She was on the orthopedic ward next door, and she was trying to get some blood gases from someone when we'd not that long been qualified, and she was struggling to get blood gases from a patient. And she said, "Oh, will you come and help me take these blood gases?" So I said, "Yeah, sure, absolutely." So I came along, and the orthopedic ward round was coming along. And at that time, I thought I wanted to do orthopedics. I'd had quite a good experience in medical school with orthopedics. Like I think quite a lot of people do, really, because orthopedics is easy to get your head around, isn't it? You know, there's the broken thing. This is what you do to fix it. It's quite good. Yeah, it's quite nice surgery, quite good fun. It's all quite, orthopods are quite jolly people in general. So I thought that I wanted to be an orthopod. And so I'm at the bedside, and the orthopedic ward round comes down, and they come to an old man in the next bed to where I was helping my friend. And they stood at the end of the bed, and unfortunately, the old man arrested whilst they were there. And the nurses called the arrest team. We piled in and tried to help. And what the orthopedic ward round did was stay at the end of the bed looking at the x-rays. And then at the end of the arrest, which was unsuccessful, they just sort of said, well, we would have fixed this bone, but we'll just move on. And I just thought, no, that's not me. I can't do that. I don't look like that. I hope I never look like that. And I just couldn't see myself fitting into that sort of, I'm be careful what I say now, but it just wasn't, let's put it that way. So I just thought, no, I'm not going to do that. I'm going to do general surgery, because I felt that I probably felt I identified with the general surgeons more than I did with the orthopods.
Okay.
So that's probably why I'm not an orthopod. And then, having been sold to the transplant unit, that's where I ended up as a transplant surgeon. And then the reason I ended up as an endocrine surgeon was because when I went to Leicester, I went there first as an SHO and worked for Professor Peter Bell, who was perhaps the best surgeon that I'd ever seen. First week I was there as an SHO, I helped him do a bilateral adrenalectomy, just me and him. He let me start and finish, and the whole thing took 45 minutes. And I don't know how he did it. He was an absolute wizard. And he taught me an awful lot. And he did endocrine work. Well, he did everything, but he did endocrine work. And I just thought, this is for me. So, I suppose not being an orthopod and then understanding what Professor Bell was up to, an extraordinary bloke. Just, one of those polymath people, just do everything. If he was on call on a Tuesday, you had to call the snooker hall, because he'd be playing snooker in the snooker hall. We're talking pre-mobile phones here. And you had to ask for Mr. Jones. He was there as under an alias. He was a brilliant bloke. So he inspired me to do, endocrine, I think.
So, Mr. Morgan, I want to ask you, if you could go back in time, what would you say to yourself to inspire yourself?
To inspire myself, I think I would say to myself, try to concentrate on a few things rather than trying to do everything. So I think I have been guilty of trying to be maybe a jack of all trades. I found it very difficult not to be interested in everything. Mm-hmm. And I might have been better if I'd have specialized in a few things instead of trying to specialize in everything. So I think I'd go back and tell myself to concentrate on a few things rather than everything. Mm-hmm. The other thing I think I'd say would be that the way we train, you move jobs very regularly, don't you? As a trainee, you're moving every 4 or 6 months for ages, and so it makes it quite difficult to get anything established that's going to be worth doing for a longer period of time, like writing a paper. It's almost impossible to write a paper in 6 months when you're on one job. It's really hard to do that. So you end up doing small projects. I think I'd like to go back and tell myself that actually commit more time to a few projects and try and keep some running for a little while, rather than desperately trying to finish everything in a 6-month period. Because there's a lot of things on my CV which are small projects, which are fine, but I think I could have concentrated maybe on spending a little bit more time and realizing actually that committing 2 or 3 years to something, when you're first trained, 2 or 3 years seems like forever, but actually from where I am now, 2 or 3 years doesn't sound like very long at all. So I think there are some projects that I didn't do that I should have done because I was worried that they would take too long. And I'd like to be able to tell myself that, yeah, don't worry about time. You've got lots of time.
Absolutely. And that nicely ties into my next question, which is, what advice would you give to medical students and aspiring surgeons?
So I think the main thing about going into surgery as a medical student is to always remember what it was that made you think that surgery was a good idea. Always remember that it's the best career in the world. And sometimes in the middle of the night when you're tired and grumpy and there's another patient to see, sometimes you can lose sight of that. But never lose sight of the reason that you went into medicine and that you went into surgery, because we're only here for one reason, and that is to help the patients. And that's the biggest privilege there is in the whole wide world. And you cannot find a job that is better than that. So always remind yourself of what you're doing there. It's really important.
Yet, here you are.
If you were down